reading a research paper together. The title of this paper is The Effect of Cardiac Preconditioning in Reducing the Risk of Kidney Injury During Cardiac Catheterization. Hello, everyone. Today, I want to share with you the latest medical research on the topic, how to reduce the risk of kidney injury during cardiac catheterization. Why is kidney health important? Many people with heart problems need to undergo cardiac catheterization or stent placement. This procedure uses a contrast agent, a special dye that helps doctors see blood vessels clearly under X-ray. However, this contrast agent can have a side effect. It may harm the kidneys, causing acute kidney injury, AKI. Studies show that 5% to 50% of patients undergoing cardiac catheterization experience kidney problems, especially older adults, and those with diabetes or heart failure, who are at higher risk. Is there a way to protect the kidneys? This study tested a unique method called remote ischemic conditioning, RIC. The procedure involves placing a blood pressure cuff on the patient's arm, inflating it to 200 millimeters of mercury, much higher than normal blood pressure, to temporarily stop blood flow for 5 minutes, then deflating it to restore circulation. This cycle is repeated 3 times, lasting about 30 minutes in total. In simple terms, it means briefly restricting blood flow to the arm and then restoring it, which triggers a protective response in the body that helps the kidneys resist damage from the contrast agent. How was the study conducted? This research, called the RIC clinical trial, was carried out at the University of Pittsburgh Medical Center in the United States. They enrolled 109 high-risk patients with an average age of 75, many of whom had diabetes or heart failure. Participants were divided into 2 groups. One group received real RIC, 3 cycles of arm ischemia. The other group received a sham treatment. The cuff was inflated only to 10 millimeters of mercury, which does not block blood flow. All patients underwent cardiac catheterization, and doctors monitored their kidney function and cardiovascular events afterward. What were the results? The study findings were very interesting. Kidney injury rate, AKI. In the group that received RIC, remote ischemic conditioning, only 14.8% experienced kidney damage. In the control group without RIC, as high as 29.1%. This means that RIC reduced the risk of kidney injury by half. Cardiovascular events, MACI. After 6 months of follow-up, patients in the RIC group had lower rates of heart failure hospitalization, heart attacks, and even death. RIC group, 16.7%. Control group, 36.4%. The difference is very significant. Why is it effective? The study also measured certain kidney injury markers in urine and blood. In patients without RIC, these markers increased significantly after the procedure, indicating real kidney damage. In patients who underwent RIC, the increase in these markers was much smaller, showing kidney protection. Scientists speculate that RIC may work by releasing molecules like nitric oxide, NO, and cGMP, which relax blood vessels, reduce kidney stress, and thereby protect the kidneys. Conclusion: cardiac catheterization carries a risk of kidney injury, especially in elderly and chronically ill patients. A simple method of inducing ischemia 3 times on the arm using a blood pressure cuff can reduce the rate of kidney injury and also decrease hospitalizations for heart failure. Although more research is needed to confirm these findings, this represents a very promising protective strategy. So, if you or your family members need cardiac catheterization in the future, doctors might use this simple arm preconditioning technique to protect the kidneys. This is the latest medical advancement showing us that sometimes the simplest methods can provide the greatest protection. Do people truly believe that healthy medicine and RIC can promote wellness? Hurry and purchase a healthy RIC sphygmomanometer to enhance your health every day. Don't forget to scan the QR code. Thank you all for watching. I am Dr. Andrew Shu Lee. Until next time.